everybody? Can you hear me all back there? Excellent, okay. Okay, so 3 in 1 million people per year. Now let's just stop to think for a moment about how really small that number really is. It's not quite the odds of winning the lottery, but those are the odds of being diagnosed with the rare, non-malignant brain tumor I was diagnosed with on the 18th of May, 2010. And that's what I'm here to talk to you today about, because that was the day that my journey as a brain tumor patient began, and the day that I learned and discovered how really important it is for patients and healthcare professionals to collaborate in order to target the best patient outcome possible. If we put our scientist hats on and chart what my patient experience looks like, this is what we see. Patient CS, 14th of May, vertigo attack. 17th of May, onset of first migraine. Patient has never had headache or migraine before. 18th of May, patient is diagnosed with 1 centimeter colloid cyst. Her treatment consisted of, from a diagnostic perspective, a watch and wait protocol, which means a follow-up of yearly MRIs to watch tumor growth. The medication consisted of migraine medications as required, and her health professional team consisted of a neurosurgeon, a neurologist, and a GP. About 2 years after her diagnosis, that tumor doubled in size. And what it did was it blocked the cerebrospinal fluid in her brain, resulting in a condition known as hydrocephalus. So on the 31st of August, 2012, a craniotomy or brain surgery was performed, and that was done in order to remove that tumor so that it could relieve the hydrocephalus. There was a complication of post-surgical chemical meningitis, and then there was the recovery. That post-surgical recovery took 18 months before patient CS could return to work and back to normal life. And thereafter, she was followed with yearly MRIs just to ensure that the tumor did not recur and come back. In 2016, the patient co-authored a scientific paper with neurosurgeons from Johns Hopkins University. And in 2017, that patient is talking about that exact paper today. And here I am. So what I wanted to do today was just take you a little bit deeper into all of this, because each of these patient experiences here is actually a data point, right? Now, patients can provide a unique wealth of information about their disease condition, their quality of life, and experience with their illness to their healthcare professionals. And especially in conditions such as mine, which was a rare non-malignant brain tumor, this can be really, really vital. And I know that as a newly diagnosed patient, I had a ton of questions. I had questions on my symptoms, my treatment, surgery, quality of life, long-term recovery, and a lot of them went unanswered. And that was because there was a lack of information available in the public domain. And a lot of those same questions came up in my online support group as well. And that was when I realized that actually my own patient data, the data that we looked at just earlier, that untapped data, could be used with other patient journeys, for example, in my online support group. And that untapped data could be taken and used to potentially help with the management and the future management of my healthcare condition. So, in June 2013, as I was recovering from my brain surgery, I started to think back to those questions and all the answers that I was trying to get. And so I compiled a 30-question survey, and I recruited my online support group to participate. And the results were really enlightening. The group that stepped up to participate wanted to co-create a knowledge base that could be used to potentially help in the management of their health condition. The great thing was I had all this data. The problem was I didn't know what to do with it. So my goals were to get this information into the public domain, number one, for individuals with colloid cysts, and number two, for the healthcare professionals who were treating them, so that those healthcare professionals could learn from the experiences of those patients. I wanted to target a better outcome and a better patient care. But as I said, I had the data, but I did not have the tools to implement it. So, in August 2013, I approached my neurosurgeon, Dr. Alfredo Quiñones-Hinojosa, known as Dr. Q, and his team at Johns Hopkins University. He was then the director of the brain tumor surgery program and professor of neurological surgery and oncology, and he is now the chair of the, it's always such a big mouthful, all of these things, the chair of the neurological surgery program at the Mayo Clinic's campus in Florida. And he and his team loved the data, and they wanted to collaborate on a new study, one that could be published in a peer-reviewed journal. Now, of course, for me, somebody who wanted to get this information into the public domain, this was fantastic because my goal of getting that information out there was now in sight. So what they suggested was, let's take this information and let's make it more scientific. And so what we did was we added 2 scientific measurement tools, the SF-36 version 2, measuring quality of life, and the Henry Ford Headache Disability Index to measure disability of headaches. And let's just get back to that quality of life one, the SF-36, because I want to talk a little bit more about quality of life, because this comes up a lot and is actually really important for me being a patient, especially having gone through the patient journey. Now, what is quality of life? Because quality of life has actually had so many papers written on it trying to define exactly what it is. Now, quality of life is, it's a physical, it's a mental, and it's a social well-being, and not just the absence of disease. And it can be further defined to health-related quality of life. And what that is, that's the physical, the psychological, and the functional, and the social domains that have been shown to absolutely be affected by health. And we need to think, well, why is quality of life important to the patient? Well, it's important to the patient, to me, because it takes into account the symptom burden of my disease. It takes into account the relationship of my symptoms to my daily functioning and the accommodations that I take into, or I do every single day because of my disorder or my disease. And why would quality of life be important to the healthcare professional? Well, it gives them that holistic view of their patient and the accommodations that they are taking into account every day. And it can help that healthcare professional maybe make changes and modify their treatment plan accordingly. So, now we can understand why it's really important that adding a quality of life assessment tool to any study is really, really valuable. So going back to the study that I'm referring to, the collaborative study that we did with Johns Hopkins University, this was the first quality of life study done on patients with colloid cysts. And talking about scientific studies, for any of you who have been involved in doing one, this is not something that happens overnight, and we wish it was. However, once you have all this data, you now have to take the data, review it, make it into a paper, and then submit it for review. So this can be a lengthy process, which can take a year or two, if not more. And I'm very happy to say that in May 2016, our paper, The Impact of Surgical Resection on Headache Disability and Quality of Life in Patients with Colloid Cyst, was accepted to the internationally peer-reviewed journal Cephalalegia for the International Headache Society. Now, the email confirming my co-authorship on this scientific publication was my winning lottery ticket for the year. And the reason behind this is, for me, it showed that the collaboration between healthcare professionals and patients can make medical practice more participatory, and patient-centered. I was incredibly grateful to Dr. Q and his team at Johns Hopkins University for making this a reality, as well as my online support group for participating. For me, this really showed patient power. So what was the outcome? Well, the one outcome here is we have a new clinical tool that can be used for assessment and hopefully help healthcare professionals in decision-making and help patients in understanding their diagnosis and answering some questions. And the clinical implications. These are just some of the few that came out, and I'll just briefly go over them. The paper showed that the surgical removal of this tumor may result in significant improvements in patient headache disability and quality of life. Now, one may think, well, that makes sense. You take it out, they have a better, headache disability and quality of life. However, let me remind you that for these patients, the majority of them, their treatment plan is a watch and wait protocol. So what that means is most of them are not offered surgery as a treatment plan. So what this did is this opened up conversation amongst healthcare professionals instead of just a black and white treatment approach. What it also showed was that patients with an incidental diagnosis, for example, maybe they had a CT scan for a concussion, it showed that they also may gain similar benefits from surgical resection in headache disability and quality of life. It showed that a poor patient-surgeon relationship, especially when the surgeon dismissed any correlation between the patient's symptoms and their tumor, showed a strong correlation with worsened headache disability and quality of life. So, how does this paper help shape the future for colloid cyst patients and healthcare providers? Well, for patients, for myself, it's a robust resource that they can take to their healthcare providers if required and discuss. And this time it's got credibility. It comes from an internationally peer-reviewed journal. For healthcare professionals, it's a resource for looking at a key aspect of patient care, quality of life. And this has not been assessed before in this particular patient group, so that's really key. It gives them an additional tool to help maybe validate a treatment protocol. And how can this tool be used to help shape the future for patient and healthcare professional collaborations in other areas? Well, it can be used as a framework, a blueprint, upon which other disease conditions of other disease conditions or disorders can be used. It shows how patients and healthcare providers can collaborate and meaningful data can be created. And it really starts with 1 or 2 questions from a patient, and through engagement and collaboration can result in a scientific paper. And from that scientific paper, what can happen is that new topics of discussion and healthcare can be proposed and discussed. As we speak, this blueprint is actually being used already for a second study on a second brain tumor group with similar study objectives, which is great. One of the things I wanted to just say is when I read this paper for the first time, well, I'd read it, but when I saw it and it was published, for me as a patient, I thought back to those questions that I had after my diagnosis, and I felt empowered for 2 reasons. The first reason was I now had answers to the questions that I had been seeking. And secondly, I knew that my own patient journey had actually helped answer those questions. So that was really key for me. But how can we move forward on all of this? Well, the way forward doesn't just start with me. It starts with each and every one of us, really. For patients, it's in the way that we approach our own healthcare. And it's in how much responsibility we take in participating in our own treatment. And for healthcare professionals, it's in how receptive we are to patient data and how we engage with our patients in a collaborative way. And for our researchers, it's in how they can use quality of life data to fully explore how to best improve the patient's outcome. So I suppose my leaving question for you today is, which one of those actions can you take when you walk out of this room? Thanks for your time. Any questions? Yes? Oh, I see what you mean. Okay, so they did say that it was retrospective, and I see what you're saying. Yep. 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 Yes. Yes, as far as I know, correct. I'd have to double check on that, but yes, they went through. It was all done retrospectively and did go through their boards. Yes. Yep. Oh, you are. Yep. Mm-hmm. Yep. Yep. Ours is, my online support group is Facebook as well. And just going back to the identifying characteristics of the individuals who participated, ours were de-identified from day one. So the scientists, when they actually analyzed the data, did not have, they were blind basically to the data. So they, yes. Mm-hmm. 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 Yes. Yeah, the online group and community support network for diseases and disorders is, that's one of the areas that I'm really interested in, is how do you delve into that, because it's a whole untapped data area, and those are the people who are really interested in sharing their patient journeys, in exploring how their data can be used to help manage and create positive change in the management of their healthcare conditions. And that's exactly when I said to the group, hey, this is what we want to do. They all put their hands up and said, oh yeah, I'll do anything to help if it's going to help the management of my healthcare condition, my child's condition, my whatever. People often want to help co-create something for the betterment of, and that's exactly what it is. Yes. Yes. They feel, they like, I helped out with that paper. They like, that's awesome. They can now take it to the neurosurgeon or whatever. And that's what I'm saying, is it just helps them feel more empowered, because they helped with their data, went in there and it helped create something that could actually create positive change. It's a very powerful thing. Mm-hmm. Yeah. Anything else?